We all know SANAC, the South African National AIDS Council, and thank you for being here with us.
Program Director, I would like to observe the established protocol with a special acknowledgement to His Excellency, former President Kgalema Motlanthe, who was also chairperson of SANAC between the year 2009 and 2014. Let me also acknowledge my fellow panelists and all the stakeholders represented here today. Esteemed delegates, media friends, colleagues, good evening to you all. My name is Zwebuko Khumalo from the South African National AIDS Council, SANAC in short. I'm an executive manager for the Strategic Information Unit. I'm representing the SANAC CEO, Dr. Thembisile Xulu, who's currently abroad on other commitments. She sends her regards and asks that I set SANAC commitment to this work. Esteemed delegates, SANAC recently launched the National Strategic Plan for HIV, TB, and STIs for the period 2023 to 2028. This is a roadmap that enables organizations and individuals to pull together to respond to the three epidemics of HIV, TB, and STI in South Africa by putting people at the center of each goal and adopting high-impact interventions to address social and structural determinants of HIV, TB, and STIs. It recognizes key population, which include people who are using drugs, sex workers, transgender people, men who have sex with men, and inmates, including other priority populations. It also proposes a range of interventions that should be explored in response to specific challenges faced by each vulnerable group. The new National Strategic Plan prioritizing addressing the drug epidemic as captured in all four goals of this plan. Goal 1 of this plan highlights the importance of addressing social and structural drivers. Goal 2 focuses on prevention and treatment interventions, which are aligned to evidence-based mechanisms, including provision of harm reduction services. The third goal of this plan makes reference to the importance of system strengthening. And the last goal, which is goal 4, focuses on governance and leadership. In South Africa, drug use is a recognized rising epidemic. The geographical location, well-developed infrastructure, and accessible ports make South Africa attractive as a transit location and a major drug traffic route. With the availability of drugs in our shores comes the increase in demand and use of drugs. Risk factors such as poverty, unemployment, trauma, including gender-based violence, are also factors that contribute to drug use. And what was once termed an urban problem has expanded into rural communities. The new National Strategic Plan prioritizes the implementation of evidence-based harm reduction services, including the provision of opioid substitute therapy and needle and syringe programs. The new National Strategic Plan further advocates for the decriminalization of drug possession for personal use. Currently, some government departments lag in facilitating and enabling supportive legislation and policies that could improve access to these interventions beyond private and NGO sector. SANAC calls for an agent prioritization by government departments to prioritize the implementation of evidence-based, high-impact interventions grounded on human rights principles. It envisions a country with medical assisted therapy clinics integrated within the public health systems, justice and correctional services. Government departments need to strengthen interdepartmental coordination to ensure that the directorate speaks to each other. SANEC supports out-of-country learning, sharing, and tools and best practices to strengthen and adapt the provision of these services. South Africa identifies a need for supportive legal framework with the development of key policies on harm reduction, peer navigation, and updating standard treatment guidelines to include the provision of methadone. The National Drug Master Plan further provides a roadmap and lists priorities to be implemented to achieve a multi-sectoral response and outcomes against each of the plan's 7 goals. Its implementation is coordinated by the Central Drug Authority with the support of SANEC. The CDA has also developed Drug Action Plan with the involvement of traditional leaders with 6 objectives to improve coordination. In addition, the Health Sector Drug Master Plan and the National Strategic Plan for HIV, TB, and STI have equally contributed to the opportunity to continue to work together and have visibility of the activities that also require the support of SANEC. The Africa Drug Policy Week comes at an opportune time as it brings together people from the Southern, East, and West Africa to influence and develop policy and ensure the protection of human rights, the prevention of life, and the creation of safer and caring communities. Thank you, and we're looking forward to a very productive week.